How does hepatitis C spread? What do we do when we are detected with hepatitis C? This virus is not known to spread very commonly in the family. Hi, I am Dr. Megharaj Ingle, Senior Consultant Gastroenterologist and Hepatologist at Zen Multispeciality Hospital, Chembur. I will be speaking about hepatitis C. What is hepatitis C? Well, hepatitis C is a virus that can cause hepatitis, that means inflammation of the liver. It is one of the two causes, along with hepatitis B, of a long-standing chronic liver disease. It is an important cause of chronic liver damage, also an important cause of developing cirrhosis and liver cancer. How does hepatitis C spread? It spreads exclusively through blood and blood products. Most of the patients of hepatitis C are the ones with history of blood transfusion taken around 20 years back, because that was the time when routine testing of hepatitis C was not available in our country. This virus stays in the blood and the liver for 2 to 3 decades before causing any damage. So most of the patients who have this virus are asymptomatic, and when they do develop symptoms, it is of advanced liver damage. So what do we do when we are detected with hepatitis C? Well, fortunately now many good oral drugs are available which can treat the virus and remove the virus with around 98 to 99% efficacy. So this virus now is almost completely treatable at any stage that is detected. So if you detected with hepatitis C, do not hesitate, don't get afraid, visit your nearest doctor, and there are easy and safe effective drugs for treatment of around 12 to 24 weeks only, which can be given and the virus can be taken care of. As I said, this virus spreads through blood and blood products, so we need to take care of getting in contact with infected blood and blood products. Most commonly it happens through blood transfusions, but nowadays blood is being tested. So common route nowadays is IV drug abuse, so that is something that you should avoid. Use of unhealthy needles, especially for injections or for tattooing, as tattooing is very common nowadays. So make sure that you use tattooing instruments which are sterile and at good and safe places. Occasionally it is known to spread through use of infected razors and toothbrushes, so please avoid using these from other persons. Rarely this can happen in patients who have chronic problems and require blood transfusions, like patients with thalassemia or kidney disease. So these patients are advised to take transfusions from good and reputed blood banks and also to regularly keep themselves testing. Does it spread in family? Well, unlike hepatitis B, this virus is not known to spread very commonly in the family. So the patient can very well stay with the family member and have a regular life. And as I said, it can be treated very easily. There is no vaccine, unlike vaccine for hepatitis A and B, there is no vaccine for hepatitis C. So the best way to prevent is to have safe practices and avoid getting in touch with blood and blood products from other patients. Thank you. This video is for educational purposes only. If you develop any symptoms related to liver disease, please see your nearby or regular consultant at the earliest.